We have to find real solutions, and this is Bending the Trend. Hello, and welcome back to Bending the Trend with your host, Norm Volsky. And we're really excited to have Kristine Karnath, who is the VP of Total Rewards for Global at Moog. Welcome to the pod.
Thanks for having me, Norm.
Really excited. So you've been at Moog for a long time now. Educate everyone who is watching and listening on Moog and what you guys are doing.
Sure. So Moog is an aerospace defense company for the most part. We are headquartered just outside Buffalo, New York. This is actually our 75th anniversary. So we were founded in 1951. We're a company that most people have no idea who we are or what we do, but everyone's used our product at one point or another. If you've flown on a plane, if you've used anything that uses a satellite, we've probably made products in there. So we make a lot of flightwear and for commercial and military aircraft, a lot of defense products for missiles and tanks and different things like that. Products to launch satellites and get them into orbit and space, products on the space shuttle. So a lot of different things that we are not direct to consumer company, but like I said, most people have used our products. So we are a global organization. We're in about, I'd say 24 different countries, and then spread across the United States. We have about 14,000 employees globally and about 7,500 employees in the United States.
I love it. And I just did want to share, like with the boxing gloves, we're fighting rising healthcare costs together. This is not a combative podcast. What are you worried about? We're on the same team. I know that for sure. So wanted to ask you, as, again, the fiduciary of, 7,500 employees in the US and, a couple more thousand internationally. What are some digital health solutions that you've implemented for your Moog employees that you would recommend to other people who are peers of yours in other organizations?
So we haven't done a lot globally. We're actually working on that. That's kind of our next frontier. But in the United States, there have been a number of solutions that we've implemented. We're actually working on one right now. We're trying to create this digital hub for our employees has both clinical and also the digital AI component to it, where basically, because we used to be very hands-on and we just can't with the size of our organization, to be able to direct people to where to go. Whether it's...
Peerage is incredibly important in this new age.
Yeah. And so whether it's, finding the right doctors or just finding the right programs that we offer, there's just too much. It's a really confusing market out there. Even though we are trying to narrow it down at Moog, it's still confusing to employees, especially for those who aren't in this industry all the time. And so we're trying to create this hub that can really direct people regardless of what their situation is. If they need medical care, if they need disability, if they need financial well-being, questions about their 401k, whatever it is, we can actually get them to the right place at the right time. Communicating in benefits is incredibly difficult because we can communicate things in January, and if someone doesn't need until July, they're not remembering what we've said or what's out there. And so a lot of our programs have lower utilization because of that, because people just don't know they exist. And as much as we try to get our vendors to work together, they've got their own priorities. And so it's just a really difficult environment for people to navigate through. So that's one that we're actually working on to getting out there. And we tried different variations before and they haven't worked. And so we're really hopeful that this new product,
fingers crossed,
works. And it's not a product that's off the shelf. So it's really something that we're creating with a vendor to really drive things forward. So with regards to programs that we've actually implemented, we have a number of programs that we've implemented, some digital, some non-digital. So some of the non-digital ones that we've implemented, we have on-site wellness centers that have worked really well for our employees. We have a lot of manufacturing. So we have a lot of people who are on site, very few people remote. Even post-COVID, we still have very few people who are remote. So on-site care and on-site services is still really important to our members. And so Premise Health is who we partner with, and they've been a fantastic partner where just the services that we offer, quality services, convenient care, low cost, and pretty much anything that we want to try or work on, they partner with us to actually do. Because their nature of their business, they have to be very personalized for companies because they're on site for people.
Of course.
And so they really work with us to personalize, not just for Moog, but for each site that we're at, because each site is very different. So that's one, and we've had them for 7 or 8 years. So they've been around for a while, and they continue to evolve and allow us to evolve along with them. And I think that's an area of the market that's really untapped right now. A lot of employers really just haven't gone in that direction because there's a fairly sizable investment that needs to happen up front.
Any others that you would recommend?
So another vendor that so the complete opposite. We've been with Prince for 7, 8 years. One vendor that we actually just implemented with is RightWay. So we
transparent PBM. I love it.
So as of 1/1 of this year, we moved to them. We had been with one of the big 3 PBMs for the past 16 years, and we were in a coalition with them. And so we decided last year we were going to leave the coalition, we were going to leave our consultant, and we were going to leave our PBM. So that was a big change for us. Once we partner with somebody, we really like to try to keep that partnership, and we don't like to change a lot for our members so that it's not just a constant revolution through different partners. And so that was a big change. And the implementation, I mean, especially for something as big as a PBM, there's a lot of work that goes into it and a lot of care. We're very paternalistic. So a lot of care went into making sure that our members understood what was going on, that we gave them time to be able to make changes to the formulary and wanted to make sure that we could communicate properly to them. So nobody was caught off guard as of January 1. And on the flip side, also making sure our finance team was comfortable. We completely changed the financing model that we had previously. We were going with the PMPM with RightWay. So we really kind of flipped our whole pharmacy on its head.
That's good.
Which we're really pleased with and we're really happy with. And I'm really looking forward to getting the data to prove out what we think everything is going to look like. Just because being with somebody for 16 years and then making that change, especially with the consulting change, we didn't have those people that we had been used to hearing from and working with. Everything was new. And so there's a lot of trust that needs to be built up over the last few months too.
I like it. Any other solutions that you've just gotten tremendous value?
So a couple smaller ones that we implemented last year. One was Leap Health that we implemented in July. Infusion therapy. That was an area that I had been looking at for years, really, and trying to find somebody who would work with us on it. Either they didn't offer it or we were constantly told we were too small. We didn't have enough people in one location to be able to make it worth their while. And so I had met Leap in September of 24 at an event, and it was the first vendor really that I heard of that was offering not only the option for employees to be able to get the care where they need, but the financing option where basically they're removing the middleman, which is going to save us costs.
Getting about 50% cost savings.
Yeah.
Infusion, and about things that cost tens of thousands, if not hundreds of thousands per infusion.
Yeah, and that was kind of a no-brainer change for us because it is such a small population that we had, but such a large cost impact for us. And so we don't make it mandatory because we don't do anything mandatory at Moog. So it is voluntary, but so far the people who have used it have raved about, just the convenience alone.
Most people would rather get infused at home than in a hospital setting where you're, in a room with other people. So
exactly. And people have said, like, I've been able to work while I'm doing it. And it's just, even from a productivity standpoint, it's beneficial. And then another one that we launched in September of last year was MIDI. So we are
our got a new round of funding. I think they just got valued at over $1 billion. So
I believe I saw that.
Team.
Yeah. And so that was also a no-brainer for us. We actually are majority male, but obviously looking at dependents, we do have about half of our population is female, and looking at that and going, this is something that every female is going to go through at one point or another. And not only savings from a clinical standpoint, but then just also a productivity. If we can just make people's lives a bit easier at a very, very low cost to do. Our arrangement with MIDI has been really successful. And anecdotally, hearing from employees that have found me in the hallway and come up to me and said, this is the best thing that you guys have
That's
ever
awesome.
launched.
I
We don't
love
hear
it.
that often. So yeah, those are two that were kind of very easy implementations. I mean, Leap was a bit more challenging just because they're so new in our medical area. I've not worked with them before, but for the most part, fairly easy implementations and in very niche areas, focusing on a very certain population for very specific problems. And we've gotten great results, great feedback from
Awesome.
them. Yeah.
So tell me about the results of the things that have been implemented for a little bit now. Like I think Premise has like got years of experience.
Yes.
And then some of these others, like what are some of the results anecdotally where you're like, hey, not only was it great strategically, but we see it in the data, increased quality or decreased cost, or ideally both?
Yeah. So, I mean, we see that definitely with Premise. So with Premise, we've had our onsites, our longest onsite site will be 12 years this year. And so with Premise being 7 or 8 years, we definitely see in the data, we hit a positive ROI, I want to say within the first 3 years. And actually one of our sites, which is very rural, very small, we implemented them because we were seeing a significant high cost claimant cost out of that group, even though they were not anywhere near the size of other groups. And so they've only been open 3 years, but we're still waiting to kind of see the long-term impact, impact on cardiac, impact on cancer. But what we are seeing from them, because they are so rural, we're seeing an impact on recruitment, an impact on retention.
That's fantastic.
And just people getting care that were not getting care before. They had to drive 2 hours each way just to get a primary visit previously. Now they can just walk, across the parking lot to get it. And so anecdotally, those things, we definitely get hear the impact on that. Our clinics that have been around longer, because we have acute care, primary care, physical therapy, pharmacy, vision, we hear from people all the time, everything from being able to cancel surgeries because they've gotten the physical therapy that they need, to better adherence on prescription drugs, to cheaper costs for glasses, to cancer diagnosis. I mean, we've heard
all through the clinics.
All through the clinics.
That's
yeah.
Unbelievable.
So because it's convenient and
focused on prevention, not after the fact. I love it.
And for the prevention piece of it, when somebody is meeting with a primary care doctor, they don't get 5 minutes with them. They get 45 minutes to an hour with them. And so they have the time to really be able to talk about what's bothering them, what they're concerned about, and the providers know who they are. So it's not like it's a bit different than going to the community. It's not quite that churn. So we see the numbers financially. There's more data that we want to analyze with that to really look at how's it affecting our return to work for those that go in on site versus non. How is it affecting, our adherence numbers? How, adherence, we're at like 95% adherence, so it's probably not going to be much higher than that out in the community. But
I think any employer in the country would take 95%.
Yeah, we're pleased with that. But we're really trying to dig in even more to the numbers and do more analysis about some of the things that are not being captured in the typical ROI. So it's so successful that when we wanted to implement our third clinic in North Carolina, which is the rural one, it was a matter of I sent an email to our CEO and said, here's the case. Do you want to meet about this? Are you okay with this? And I got an email back and said, just go ahead.
Great.
And there is like significant investment because you have to build out the building. Like we had to buy a building, we had to renovate the building. So it's not just a matter of implementing a vendor. Yeah. It's a matter of actually putting in the money to have the space. So it's that successful that it's just become if you think it's worth it.
So happy to hear it.
Yeah.
Love it. And you already said you're co-developing something. So you're someone who puts things into your own hands, but are there any things that don't exist in digital health today that you wish did?
I think it's that one piece.
Okay. Other than that.
Yeah, I would say probably more from a communication standpoint, really reaching people. I mean, there are a lot of solutions out there and, yes. I hear from a lot of them and we are very careful not to just put in things to check a box. Like yes. They have to have a purpose. I would say one thing as I'm talking through this, I would say one thing would be, how do we measure that? How do we measure all of those solutions that are out there? We hear the ROI from our vendors, and I always have a bit of a skepticism with
Yeah,
those
as
ROIs.
many do, and I'm actually serving on the advisory board of the Validation Institute. I'm of the belief that unless you're validated by an verified third party that has no perverse incentive, I think why would a benefits leader believe you? Because there's a lot of false data out there.
There is, and there have been vendors that I've worked with where they've given us data, and I thought there's absolutely no way we are seeing that response. Some you can, because of the anecdotal data, you can buy into, but yeah, I would say, being able to communicate, drive people to where they want to go, and then be able to actually verify that ROI ourselves, because I think that's something that most employers just don't have the ability to do, or we don't have the data, we don't have the resources. And that's really important to know, is something actually working or not? I mean, I've talked with vendors where they'll come back and say, oh, it's an 8-to-1 ROI. I immediately dismiss them because there's no way.
Unless they can validate it, unless they have data.
Which I've never seen it. So
the best thing you can do is, if you have happy customers, expose them to your prospects, let your current customers, help you sell your future customers. Yeah. That's, I think, an important thing. And last question, who do you nominate to be the next guests on Bending the Trend?
Okay, so I would say one person who I've worked with for a number of years, Tanner Brunsdale from Lyft. He would be a good person to talk to. So yeah, he's I think done a couple of things like this before, and I'm on a couple boards with him.
Cool. Well, you're welcome to come join us. It'll be very friendly. We'll fight rising healthcare costs together. And again, Kristine, thank you for what you do for the industry. Thank you for sharing your wisdom and your advice that should help others, drive better healthcare outcomes for their employees. So thank you so much, and keep doing the great work over at Moog.
Yeah, thanks for having me.
Thanks for watching Bending the Trend, where we are looking to fight rising healthcare costs. We are asking benefits leaders what digital health solutions they've implemented that has helped them bend the trend.